Hello, welcome back to The Remedy, brought to you by Coos Health and Wellness. I'm Eric Gleason. We're joined again by Kate Frame from Advanced Health. We're going to talk about Naloxone. Thanks for joining us again.
Yeah, thanks for having me.
So what is Naloxone?
Naloxone is an overdose reversal medication, and it can be administered nasally through a nasal spray or through a syringe, like a vial in a syringe, and it's known by the brand name Narcan.
So through the nose or through a syringe?
Mm-hmm.
And if you were going to have to give it to someone else?
Mm-hmm. Right, so when someone's overdosing, you couldn't give it to yourself because you would be overdosing.
You'd be busy.
So you'd be busy, yeah.
Be busy.
So if someone's overdosing, their breathing will be depressed.
Right.
And there's a really short window of time when you could maybe save someone's life by administering naloxone. So you can either administer it, whatever you got on hand, it would be either a nasal spray or a syringe.
That would, well, all right. I didn't realize that it came in two different formats.
Yeah.
So how does it actually stop the overdose?
Yeah, so opioids bind to people's opioid receptors in their brain.
Sure.
And so when somebody's overdosing and you administer naloxone, it kicks the opioid off of the opioid receptor long enough for that person to begin breathing again, and then they need to seek medical treatment immediately. Sometimes the opioids can bind again back to the opioid receptors, so we want to make sure just because you administered naloxone doesn't mean that person is safe from death related to their overdose. They need to seek medical attention.
Right, they still need emergency
Yes.
treatment at that point because it's unbound for a minute, but not necessarily
right,
forever.
long enough for them to resume breathing again.
So where do you get Narcan?
You can get it multiple places. So the first place, if you want to get it for free, you can get it at Coos Health and Wellness 2 days a month. HIV Alliance gives it away for free at their clinic days, the second and fourth Friday of every month. Mm-hmm. And then you can also go into your pharmacy and ask for it. You don't need a prescription. You can just walk right in to the pharmacist, ask for naloxone. He will prescribe it to you and give it to you and then walk you through how to use it. OHP will cover it if you go into a pharmacy. And for people who have private insurance, there might be a copay, but a lot of it might be covered by your insurance as well. So check with your insurance company.
Okay.
Yeah, and we're also planning some upcoming community trainings to get naloxone out for free into people's hands. So in February, be watching. We're doing a training at each of the 11 libraries in Coos and Curry counties, and we'll be doing walk-in training. So once we have those dates really solidified, we'll put some information out there. But every library between Dora, Lakeside, and Brookings will be doing a naloxone training.
So that's free to people to come and just get the training on how to administer either nasally or
yes, and they'll receive
a
kit. They'll receive a naloxone kit when they come in as well. It'll be nasal spray. So yeah, free naloxone.
So free nasal naloxone and training on how to use it at one of the libraries in Coos and Curry counties at some point in February.
Right, it'll be, so whatever library you go to, that will be where you would want to go to get the training.
Wow.
Yeah.
Well, that's good. I mean, it would be nice to get this out into the hands of more people in the event someone runs across someone who is overdosed. Maybe we can do something.
The Surgeon General issued a statement saying that he wanted to see naloxone saturated, just like opioids are saturated. We want to see naloxone in the hands of everyone. It's similar to CPR. God forbid you have to use it, but everyone should know how, and everyone should be ready and prepared.
No, I think that's absolutely amazing. So you can get it at Coos Health and Wellness for free right now on the days that HIV Alliance are there, and we'll have those. We'll have that up on the screen, and we're going to have the February library tour, naloxone tour.
Yes.
In February, so you can go there and you can get that. So if you want to become more informed and become someone that can help someone in an overdose situation, hit one of those places up. Pay attention to when Kate's group's going to be at your local library. And for The Remedy and Coos Health and Wellness, I'm Eric Gleason. Thanks for joining us.